Good afternoon, Miss Pearson. My name's Nathan. I'm going to be your nurse this afternoon. How would you like me to address you today?
Call me Julie, please.
Okay, Julie. I just talked to the day shift nurse, and she informed me that you were admitted from OB triage this afternoon. Can you tell me what brought you into the OB triage today?
I have a terrible headache. I've been throwing up all day. I haven't thrown up the whole pregnancy, so this is weird for me. I'm so bloated, even my face is getting swollen, and it never did that before. I just feel like crap.
When did this all start, Julie?
Last night after eating Taco Bell, I really was craving a Gordito Crunch, and since then it's been downhill. I started throwing up after the office around 10 o'clock.
Well, I doubt it's the Taco Bell that did all this, but I really can't promise you that. However, your OB doctor did call, believes that you may have preeclampsia.
Seriously? What is that? Is it going to hurt my baby?
Actually, preeclampsia occurs in about 10% of pregnancies, and no one really knows what causes it. It causes several of the symptoms you've been describing, such as your headache, and that could be a side effect of your blood pressure, which we just took and was 180/117. Also, you've had nausea and vomiting. The big concern is your blood pressure and how well your kidneys are working. So we're going to be collecting your urine for 24 hours to see how your kidneys are working, and also giving medications to help with the high blood pressure, the bloating that you're feeling. By watching your blood pressure, we can work towards preventing any harm to your baby.
My father died from kidney failure. Will this thing I have cause permanent damage?
Well, that's what I'm working towards monitoring. We're collecting your urine and running blood work to see how your kidneys are functioning and if there are any negative changes over time. The one intervention that brings all these issues under control is actually delivering your baby. So if your doctor feels you're in danger of kidney damage, he may decide to deliver your baby.
So, once I have the baby, I'll go back to normal?
A majority of the time that's the case. The cause isn't known, but it is known that delivery reverses the issues you're experiencing and lessens the chance for harm to your baby due to your high blood pressure. Do you have any more questions for me?
No, but I'm sure I'll come up with some shortly.
No problem. If you have any questions, just let me know. I want to take a few minutes and do an assessment to see if there have been any changes since you first arrived on the floor. So after doing an assessment, there were several findings. For vitals, the patient's blood pressure was 180/117. Her pulse was 82. O2 saturation was 97% on room air. She had a temperature of 98.7. Respirations of 17 with crackles in her lower lobes bilaterally. She also complains of blurred vision, headache pain rated 7 out of 10, has general body edema of 2+ but no pitting. Her skin is warm and dry. She has a feeling of nausea with vomiting but no abdominal pain. And they also discover that she is 34 weeks gestation period. Prior to her admission to the floor, some labs were ran. Her proteinuria is 3+, her platelets are 89,000 megaliter, and her urinary output is averaging 24 milliliters an hour. So based on the information provided, after performing the assessment and gathering the presented data, what would we want to monitor throughout the shift for patient and fetus safety? The second question, what changes in the patient's status would prompt you to call the attending physician? The third question, what changes, both additions or deletions, would you make in regards to patient education?